Okay, perfect. So hi, everybody. This is Cassie Westmoreland with the Division of Housing. Clearly still having some technical issues, however many months we are now into COVID. So thanks for bearing with us as we work through that. We are going to be recording this webinar so that we'll have the ability to go back to it. We'll post it on the DOH ESG page. So thank you all for joining us and being a part of this. With me this morning are Galen Coyle-Joseph and Kelly Forsbauer, who are some of our ESG team members. We will be monitoring the chat as we go along, so please feel free to throw any questions into that as you have them. We'll also be stopping periodically to check questions. I have an hour and 45 minutes for this webinar because I wanted to make sure to give folks plenty of time for questions. I don't think we have an hour and 45 minutes of material, so hopefully we'll be able to give you a little bit of time back in your day, and again, this will be recorded. One note, and Galen, you can go ahead and go to the next slide, please. When you type into the chat, please make sure to post to all attendees, not just all panelists. That way everybody who is part of this can see what your questions are and what you're asking about. So yes, so welcome. Thank you for being a part of our ESG program, Emergency Solutions Grant Program. We have a lot of existing recipients and we have a lot of new recipients as well with this huge influx of funds from the CV pot. We will get into our acronym soup in just a little bit, but in the meantime, if you would please plug in your name, your organization, and your location in the chat. Again, make sure it's all panelists and all attendees, not just all panelists. Just a couple of things for housekeeping before we get started. Attendees are all muted and your video is off. We can't see you, we're not recording you. So do know that you'll have to chat into, or you'll have to post into the chat for us to see or hear you. And again, this webinar will be recorded on the ESG page, which is where we are going to host all of our ESG recordings, resources, tools. We're trying to pull together a lot of things that we can help make ESG a little bit easier, and that's going to be the web page where you can access that. So seeing lots of names and organizations coming into the chat now, which is really exciting. So thank you all for being here and taking the time to be with us this morning. All right, next slide. Okay, so just a quick agenda of what you can expect this morning. So we are going to talk through timing and expected contract dates. Hey, Jim, I saw you just pop back on. We figured it out, but thank you for joining us again. So we're going to talk through timing, contract dates, which I know you guys all have lots of questions about. We're going to dive into ESG CV2 basics a little bit. So acronym soup, Emergency Solutions Grants, and anything that has that CV next to it is funding that comes to us specifically from the CARES Act. You'll see ESG CV1 and ESG CV2, and that's because we had two tranches of funding that came to us as the state of Colorado. So that's what this is about. ESG CV1 is already contracted. ESG CV2 is what many of you were just awarded. Then we're going to talk about ESG 20. So ESG is a funding source that we get year over year. It is a formula fund. Generally, Colorado gets about $2 million a year for those programs, for the ESG programs. Just for context, I'm sure many of you have heard us say this before. With the CV funding, we got $33 million from ESG CV. So quite a large increase, but we still do have the regular ESG funds to allocate as well. Then we're going to talk a little bit about grant administration basics, regardless of your funding source, whether it's the regular ESG, the ESG CV, just to clarify some basics since we do have so many new folks, and even our existing grantees have lots of new staff who have maybe never done federal funds before. They're quite arduous. So we want to make sure we're providing you all with the right tools to be able to administer these funds. Then we're going to go into a little bit about fiscal agents and some of the nuances for those agencies who are acting as pass-through entities with these funds. We're going to talk a little bit about monitoring and what grantees can expect in the next year around monitoring, and then we'll have time for questions at the end. So like I said, I don't think we'll take the full hour and 45 minutes this morning, but I did allocate that amount of time so that we have plenty of time for questions. All right, next slide. So for timing and expected contract dates, I put all of the funding that we have out right now on this so that folks who do have funds from all of our various NOFAs can kind of have an idea of where these grants overlap and how their timelines overlap. So for ESG CV1, again, that's what was already allocated. Those contracts are already executed. Those costs can be reimbursed from March 27th through 2020 to March 31st through 2021. Any of the ESG CV funds do have that pre-agreement ability, which means that we'll sign the contract after when you can actually start expending the funding. And this is trying to give you all a little bit more flexibility as you respond to this crisis. We know that it takes a little bit of time for our contracts to come all the way through, and so we want to make sure that we're trying to be as flexible as possible. One point to note on the CV1 funds, the COC or Continuum of Care contracts that are funded for homeless prevention and rapid rehousing, those agreements are actually being extended through March 31st and potentially even beyond that, because with our CV1 funds, we have up to 24 months of rapid rehousing allowance that can go to providing 24 months of assistance to folks. Unfortunately, with our CV2 funds, we only have 12 months of assistance that can be given through rapid rehousing. And we'll get into that a little bit more later in the presentation. But we're wanting to make sure that we give as much flexibility with those COC funds, or I'm sorry, with those ESG CV1 funds, because they do allow for that 24 months. That has to do with some timing and some decisions that were made at the federal level. Unfortunately, something that we don't have the ability to control, but something we are trying to be flexible with. So for the CV2 funds, we are going to have those cover October 1st of 2020 through March 31st of 2021. Our intention with those is to help offset the massive challenge that we all have as Colorado facing a cold weather shelter season in the middle of a pandemic. We are pushing those contracts and those agreements right now, hoping to have those out to you by the end of this year or early next year, but do know that you will have the ability to go back to October 1st, 2020 with the CV2 grant agreements that are being written right now. There will be one more NOFA released for the remaining CV2 funds. It will prioritize agencies in geographic areas that have not yet received any ESG funding. So we're really trying to make sure that between all of the increase of funds that we have, we're really covering the whole state, not just the folks who are used to getting ESG or the folks who have gotten it before. That does not mean that folks who have ESG or ESG CV cannot apply, but we do want to be very transparent that our intention for the remaining 10 million or so is going to be to get into areas that have yet to receive CV funding, that have yet to receive federal funds for dealing with the COVID pandemic, and that are being hit by COVID. That will come out later in December. We will have a more extended NOFA timeframe for that, since it will be over the holidays. So we will likely be asking for applications back early February to give agencies time over Christmas and New Year holidays to actually be able to write those applications. So keep an eye out for that. If you are not on the DOH listserv for funding opportunities, I will put that link in the chat right now. Please make sure to sign up for this. It's going to be the quickest way for everyone in this webinar to get access to any NOFA, not just the ESG or ESG CV funds that we put out, but any NOFA that the Office of Homeless Initiatives puts out will be sent to the folks who sign up at this listserv. So I just put that in the chat so you all should see it. I will say my internet is being very slow today, so give it just a second to come through if it hasn't yet. And then with the ESG 20 awards, again, that's the regular funding that comes to us as a formula grant every year. Those agreements will be covering April 1st of 2021 through March 31st of 2022. And we will actually be primarily amending existing ESG contracts to extend the deadline as well as add more funds. And that's frankly just so that we don't have to draft 50 new agreements and so that you all don't have to sign 50 new agreements, trying to make things a little bit easier administratively during COVID. I don't see any questions about any of that in the chat, so let's go ahead and go to the next slide. Okay, just a couple of other miscellaneous items to keep in mind. So contract information goes to the signatory authority on file. So when you all submitted your NOFA, your applications, you listed someone in your agency who had the signatory authority. We just want to mention this specifically for larger agencies who have many folks that are working on these agreements. Whoever is listed as that signatory authority will be the person who is getting the executed or the agreement to execute. That comes through our DocuSign system, so it will be sent to that person's email. For smaller nonprofits where you have 1 or 2 or 3 people running the show, this won't be an issue for you, but for folks who are larger groups who are working with many staff to get these grants executed, just know that whoever that signatory authority is going to be the person that this is sent to. Please reach out to your contract manager if you don't think that that's appropriate or if there's other ways that we can do that. Unfortunately, the DocuSign system is not as flexible, but there are workarounds where we can have other staff assigned or notify other staff when those go out. We would just need to know from your perspective who that is. But from our perspective, whoever is the signatory authority is going to be the person who is going to get the actual agreement when it is ready to be signed. One thing that we want to note is just please review the entire contract, grant agreement. Anecdotally, we use those kind of irreplaceably. They're different. Our contract team wants us to make sure that we know that they're different. But please read the entire agreement that we send to you and take special note of a couple of things. They have changed over the years, and especially with the CV grant agreements, they are different because there's actually different legislation that's dictating those funds. So the payment schedule is something that we've had a lot of questions about recently. The state holds $1,000 for grant closeout. That's something that we do across the board for our agreements, and that is for our federal agreements. And that is to make sure that we have all of the reports and those sorts of things that we need. So we just want to make sure as you all are planning for your reimbursement requests that you know that that $1,000 might be held at the end so that we can make sure we get our reporting that we need to submit back to HUD. Performance milestones is a section in your grant, and it will actually have all of the required documents and reporting schedules and all of that sort of stuff. And so that's a good spot to look at if you have any questions about what's expected of you. So really fun things like certificate of insurance and 504 self-evaluation forms and those sorts of things. Details for that will be found in your performance milestones. Reimbursement requests and quarterly reporting requests will be there as well, like I said before. And feel free to reach out to us with any contract questions or comments. Normally, we will send the agreement before you sign it so that you can take a look at it. If that is something that you want, please make sure to just let us know, and we are happy to share that with you. We know some of you have very arduous legal review processes that you have to go through. So if there is something that we can be doing to make this process easier for you, feel free to take a look at any existing agreements that you already have, if you have them. If you are new to this program, completely new, we are happy to send you drafts and templates so that you can go ahead and look at what is expected to be in your agreement, kind of get an idea for what's coming your way. We are more than happy to share that with you. So if you have any questions or comments on that, please feel free to reach out and let us know. Again, no comments or questions so far in the chat, so let's go to the next slide. Thank you, Galen. Okay, so we're going to dig first into ESG CV2, primarily focusing on the differences from ESG CV1. If you are new to ESG across the board, or if you're new to the CV funds with this round of funding, there are a few resources on our ESG website. Kelly, if you wouldn't mind putting the ESG DOH website in the link or in the chat so that folks can have access to that. But really right now, we're going to focus on the differences between CV1 and CV2. So the first big difference that I have already mentioned is that rapid rehousing is only for 12 months worth of assistance, not 24 months, which is what is allowed in CV1 as well as with regular ESG. This has to do with the timing of when HUD released the ESG CV notice, which is basically the program guidelines that they drafted in response to the CARES Act. That didn't come out until September. And so there is a different expectation for our first tranche of funding and our second tranche of funding. That makes planning and tracking these funds very difficult. And we apologize in advance because we know that a lot of that burden is going to fall onto you all. So thank you in advance for that work. And do know that many states are requesting that some of these differences be waived. Colorado is also requesting that the 24 months, the 12 months, I guess I should say, allowance be waived and allow us to go up to that 24 months. We have no idea what's going to come of that, especially with the transition, the presidential transition that's happening right now. A lot of the long-term expectation of these funds is pretty up in the air right now. So we will keep you all posted on that. We are trying to push for that 24 months, but as it stands right now, and as is in your current grant agreements, you can only support folks in rapid rehousing for up to 12 months of assistance. There are a few other allowances in ESG CV2 that are specifically called out in your grant agreement. So things like hazard pay, which is for frontline staff who are working, who are at risk of getting COVID, volunteer incentives, so things like gift cards and other incentives to help volunteers continue to be part of your program. We know a lot of volunteers are hesitant to do that now. Landlord incentives, so for those of you who have rapid rehousing through, and this is all through ESG-CV, this does not apply to regular ESG, just want to make sure that's clear. But for those of you who had rapid rehousing, you can use some of the CV funds to collaborate and partner with landlords through things like increased security deposits, increased upfront rental costs. There are very specific expectations for what that can and cannot be. So please make sure to look at your grant agreement. Please make sure to look at the notice. And as always, let us know if you have any questions, but we can use ESG CV2 funds for those activities. Hand washing stations for folks who are doing street outreach and other hygiene and basic services like that for folks who are living out of doors. And then training, specifically for training on preventing and managing infectious disease control. And these can be used across the components that you're funded for. So emergency shelter, for example, can use hazard pay, volunteer incentives, and training. And we'll dig in a little bit more about how to notate this. This is something that's available under CV1. We're noting it here because when we did our CV1 agreements, we didn't have the notice from HUD yet. And so this is one of the new things that they have let us know is available. You will see that we are not including this level of detail in your grant agreement budget. And the reason for that is because we are trying to make these grant agreements a little easier to manage from an administrative perspective. So your grant agreement budget is just going to have the main components for which you were awarded. So that's going to either be emergency shelter, street outreach, rapid rehousing, admin, or HMIS, or data collection within that HMIS line. And that is because if we were going to give you this level of detail in your grant agreement and you needed to move things around, that would require about a 3 to 4 week process of a contract amendment. And so we are not doing that this time. We're trying to make these budgets a little bit easier to manage. They will look a little different than your CV1 and even your ESG agreements if you guys do have those. But your Neighborly budget, which is our new grant management system, the Neighborly system, we will have this level of detail in those budgets. We are having to track all of this and report it to HUD on a quarterly basis. And so that's why these budgets are going to look different. We do still have to track all of this for HUD, but we are trying to keep it so that we don't have to do amendments every time we need to make small changes. We realize you all are responding to the crisis of COVID on top of the crisis of homelessness. And so we're trying to be flexible with that. So that's why that's going to look different. There's also the ability to move up to 10% of the line item, of a line item to another line item without requiring that amendment. You do still have to have DOH approval before you initiate these changes, but there are going to be some differences like that in these agreements that are not in previous agreements. The reason for that, in that last note, about 3 bullets up from the bottom, is because right now, with all of the COVID funding that we're getting, it's taking about 6 weeks to execute contract amendments, which is a lot longer than it usually takes. And we want to make sure that we can be as flexible to meet your needs as possible, since you all are the ones doing this work. So feel free to reach out if you have any questions. Your contract managers have already been in contact if you have CV1 or ESG to ask about some of these flexibilities. But if you are new to ESG CV2, that's why these budgets are going to look a little bit different. We will get into that a little bit later. We do want to talk about the difference between street outreach and safe outdoor space as well. Safe outdoor space is something that we've been talking a lot about in Colorado recently. Unfortunately, a lot of our folks experiencing homelessness are still living out of doors. A lot of them are scared to come into shelter, understandably. And we just want to make sure that we can talk about how ESG can support safe outdoor space through supporting the street outreach workers who are going into safe outdoor spaces and actually providing services to folks who are potentially residing in those spaces. Unfortunately, we can't fund things like the operation of those spaces. We can do things like hand washing stations and showers, but we are not allowed to do the actual operation of that. We've had a lot of questions, so we just want to make sure. Unfortunately, that's not something that we at DOH can change. That's a HUD thing. But that's how we are able to support outdoor space, is by expanding street outreach, which is definitely a priority for us in the Office of Homeless Initiatives, in order to help connect people to housing directly from the street without having to go in shelter as much as possible. We also have the ability to do temporary emergency shelter. This one is very vague. We're getting continual updated guidance from HUD on it. We can answer questions as much as we can at this point in time. Essentially, temporary emergency shelter is any structure or program that is being set up only in response to the COVID crisis and should end once COVID is over. So if you are expanding existing programs or changing the sites of existing shelters, that would not actually be temporary emergency shelter. That would fall under regular emergency shelter. The reason we want to point that out is because specifically with the temporary emergency shelter, there are some continuing conversations within HUD about those funds. So for example, if you guys really like to read HUD regs, which our team does, you will notice that temporary emergency shelter actually allows for the acquisition of buildings. And what we are hearing is that if we use temporary emergency shelter to acquire a building, once COVID is over, we are expected to pay HUD back for that acquisition. So there are some things like that that are making us a little hesitant to use temporary emergency shelter, especially because so many of our activities will actually fall under the regular emergency shelter. Things like hotel motel vouchers if there's no more shelter space because you're a socially distanced shelter and you can only allow 50 to 75% of the normal capacity and you want to use hotel motel vouchers, that is eligible under regular ESG. So we're trying to push folks towards that. But if you do have a project that you really feel is temporary emergency shelter, there are a few other flexibilities there. Oh, it sounds like my audio is cutting in and out. Hold on 1 second. All right, I'm going to talk like this. Evan, can you let me know if you can hear me better if I speak directly like this? I will keep talking. Kelly says the audio is fine on her end. Okay, great. I'm hoping that it's recording well. I'm sorry that it's not. My internet has been terrible lately. I apologize if you can't hear me. But yes, so that's the temporary emergency shelter component. Again, if you do have projects that you think will be under that temporary emergency piece, there are a few additional flexibilities. It's just, high risk, high reward kind of situation with HUD. So, okay, I don't see any questions about this specifically. So Galen, can you go to the next slide, please? Okay. Across ESGCV, we need to, actually I do have one question I see from Keely, so I'm going to go ahead and answer that. So ESGCV1 does cover hazard pay, Keely. We did not speak to it when we talked about ESGCV1 or when we executed our grant agreements because we didn't know that it was an option. If you would like to use ESGCV1 to cover hazard pay, all you need to do is reach out to your contract manager. Keely, with Attention Homes, your contract manager would be Chelsea Mandel. So just let her know what that budget needs to look like. We sent out detailed budgets for the CV1. You're welcome. We sent out we sent out detailed budgets for updating the CV1 amounts. It feels like 3 months ago. It was probably closer to 3 weeks ago. So if you didn't get that, just reach out to Chelsea and let her know, and she will be able to send that to you, and we will just quickly update your budget and Neighborly. As long as we do that before you pull your first draw for CV1, you should be good to go, and we can update it and tweak it as we go along. But the sooner folks let us know about what those details look like, the better. Okay. So, connection to COVID-19. Across ESGCV, regardless of which funding source you are utilizing, your actions must be related to COVID-19 in some capacity. So we are working with HMIS leads to figure out how all of these funds work together and how we can use the CV funds to free up other funds that might have already been distributed to projects that aren't specifically COVID related. This has kind of tapered off as we've gotten into the pandemic, but we are still working pretty closely with everyone involved in managing these funds. Just a quick update. We still know that the funds must be used to prevent, prepare for, and respond to COVID. We don't have too much more detail beyond that still, unfortunately. I can say that it is at the program level. It does not have to be at the individual family level. So you don't have to document with every single case or household that you're serving how that household is impacted by COVID. At this point, really, it's, we're doing a street outreach program because folks who are living out of doors have less access to hygiene and are therefore at higher risk for COVID. You will see, because we don't have too much detail about exactly what that looks like, we are probably erring on the side of over documentation for that. So we are going to have you all reporting on how your project has connected to COVID in your quarterly reports. We are going to be asking for that sort of program documentation. But again, it does need to be at the program level, not at the individual household level. The other piece that I can say is that prevent, prepare for, or respond to COVID really relies on how your geography is currently impacted. So if you're in a community that does not have COVID yet, I don't think that's possible right now, but if you are, then your actions would be preventing COVID, right? You're implementing social distancing, you're doing increased sanitation, et cetera, so as to keep COVID from coming into your program. If you are in a community that does have COVID and you are actively getting your program ready to deal with that impact, then you're preparing for COVID. If you are in a project that has an active COVID outbreak, then you are responding to COVID. Again, that's really all that the detail that we have at this point, but please, I would highly suggest that you all err on the side of over documentation, as well as we are working with HUD to try and get an expectation of what their monitoring policies are going to look like and what sorts of documentation they will have or that they will expect when they do monitoring for CV1 funds. We don't know what that looks like yet. So more documentation, better. I realize that's much easier said than done, especially since, our team is not working on the front line. So however we can be helpful in that, let us know. Like I said, we do have questions and places in our quarterly reports for you all to document that. So hopefully that should meet that requirement. Apologies in advance if it doesn't. The last note that I have here, we are encouraging agencies to spend down existing ESG funds on these increased costs while you're waiting for the CV2 agreements. Again, we know it's taking a little bit of time for it to get through our process. Our contracting team is completely slammed right now trying to get all these contracts out the door. We are doing everything in our power to help them get these through and executed, and we know it's probably still not fast enough. So, if you are worried about COVID costs and you have other ESG funds, feel free to use these funds on those costs. Reach out to us. We're happy to help you all work through the best way to spend down these funds. And again, unless you're needing one of these new flexibilities like the landlord incentives or the hazard pay or those sorts of things, you can use regular ESG funds for these costs. They don't have all of the same flexibilities, which we'll get into in just a minute, but they are things that you can use for your shelter, your outreach, your rapid rehousing programs, et cetera. Okay, I'm not seeing any questions, so let's go ahead and go to the next slide. Awesome, thank you, Galen. So just a bit about data collection and how reporting is changing with ESGCV. As long as you are not an an HMIS lead agency, this should actually be a little bit easier for you. So normally with regular ESG, we have annual CAPERs that are required, that annual report. With CV, we actually have quarterly and cumulative by project type reports. It's very nuanced, it's very technical, but the HMIS leads will be in charge of pulling these reports rather than each recipient or subrecipient. So all that we will need you all to do is just make sure that your data is input correctly and input in a timely manner. And the HMIS lead agencies will actually be the ones pulling those reports for us as the Division of Housing. If you do not know who your HMIS lead is, please let us know, and we are happy to connect you with them. We meet with them very regularly and are working very closely with them to make sure that they know who we have funded, we know who they are working with, and so between that communication, we should be able to make sure you all are all set up and ready to go. But if you have not had contact with your HMIS lead yet, please let us know sooner rather than later. CAFE has been chosen as the ESG comparable database. So that is for folks who are victim service providers. You legally are not allowed to use CAFE, or you're legally not allowed to use HMIS, as I'm sure you all know. We historically have had a few different comparable databases. And so we are working with the DVP, Domestic Violence Program, I believe is what that acronym stands for, with the Colorado Department of Human Services, DHS, Department of Human Services. As our sister agency, they have CAFE. We have gone over their list of grantees and our list of grantees for about a year and a half. And all of our ESG grantees are also DVP grantees. If you are on the call now and you use DVP, or I'm sorry, if you use ESG and you don't use DVP, please let us know. ETA of CAFE is actually the end of this year. We will, oh, sorry, I'm getting confused. So, yeah, so end of this year, Mark, we are rolling that out first with the folks who had ESG in 18, which is the CAPER that we are doing right now. Early next year, we will roll out CAFE for the remaining folks. Bridget, if you are with Housing Solutions, you should be okay to not use, not have access through serving DV providers. Okay, Bridget, definitely shoot me and Kelly an email, and we will get with you and figure out how to document that you are serving DV providers. I'm going to go back and look at the questions. So the lead in Mesa County is the Balance of State, Scott. So you can reach out to Tyler and Denny with CCH. If you don't have their contact, just let us know and we can put you in touch. And then Megan with La Puente, same for you. So HMIS is going to be the Balance of State, which is Tyler and Denny. Again, if you don't have their contact, please let us know and we will get them in touch. Okay. All right, so yes, so the CAFE as the comparable database is now baked into ESG grant agreements. So for any future grant agreements with CV2 funding or the ESG 20 funding, you will see that that is listed there. We know that this is a change. We know that for some agencies, you know, this is going to require things like client management tracking in CAFE when it used to just be DVP reporting and all of those sorts of things. Your contract manager is here to help you through that transition, and we are working with Chelsea Baldwin with CDHS very closely to create tools and policies and procedures and things that make this easy for you. So please feel free, reach out, let us know what questions and concerns you have, let us know how we can make this easier for you. We chose CAFE specifically so that our grantees would not have to do double data entry. Our intention in this is to make things easier. If that is not the case for you, please let us know. We haven't heard that it is a challenge for anyone yet, but that doesn't mean that there's not someone out there who will be challenged by this. So please, please, please feel free to reach out and let us know. Okay, so one note here. There will be an expanded need for HMIS lead agency support and end user licenses across Colorado. The COCs and the HMIS Collaborative are working together to figure out what this is. So again, just another friendly reminder, if you haven't talked with your lead yet and you're hearing, this increased data collection, you think you're going to need more support or more licenses, please reach out and let them know, and we can either put you in touch with them or help get those resources out to them. Will ESG and the CV grants be tracked differently? Naomi, that's a great question. Yes, they will, in terms of that there will be different reporting timeframes, there will be different reporting requirements, but that should not fall onto you as the agency. That should fall onto how we pull the data from the systems. There's not going to be different questions in terms of like how you do intake and how you manage someone once they're in your program. It will really just be how we're pulling the data, the time frame that we're pulling the data, and those sorts of things. Yes, that is a relief. We were a little worried. And again, this is what I know as of 11:43 a.m. on December 7th. We will make sure to let you all know if anything does change. But as of now, we do not know of any changes that will need to happen in terms of how you all are doing data entry. So Megan, the question was, will we need to pull any reports for CV2, or will that be done by the HMIS leads? That will be done by the HMIS leads. In terms of what is reported to HUD, you all will still pull your quarterly reports from HMIS or CAFE to submit them to us as the quarterly report, which is what you are already doing now for your ESG funds. But in terms of the actual reporting up to HUD, that will come from the HMIS leads. And just in case anybody's curious, I don't know if folks are, but they're actually going to be pulling it by project type. So they won't be pulling La Puente's report. They'll be pulling all emergency shelter reports as funded by ESG CV in the Division of Housing's ESG recipient pool. So it's going to look quite different, but again, that will not fall onto you all. That will fall onto the leads. Okay, any other questions? I think we got to all of them. If I missed your question, please feel free to put it back in the chat. All right, next slide, Galen. Okay, one more thing. I did mention this in the CV1 webinar. The CARES Act specifically requires housing first. So this language provided further that none of these funds provided under this heading in this act may be used to require people experiencing homelessness to receive treatment or perform any other prerequisite activities as a condition for receiving shelter, housing, or other services. Just want to put that out there, be very clear about that. This is in the language of the CARES Act itself. That is not something that we can change unless there is an act of Congress. So if you have questions about specifics of how this will impact your program, what this means, again, please reach out, but do know that we cannot have any prerequisites for serving folks as a condition based on the CARES Act itself. That is for any ESG CV2 funded project. Okay, next slide. Nan has asked, do we have a good description or definition of low barrier, and what about safety? Nan, that's a great question. So we do have a guidance document on the DOH page that talks about the highlights of like a best practice emergency shelter. We can also put out some resources if you have specific questions around how to deal with things like safety. And, so for example, like the signing of a behavioral agreement in order to stay in a shelter is something that we cannot do with CV funds. But there are ways around that in terms of how to do safety, how to create safety in a shelter. We do have that document, best practice document for emergency shelter. It doesn't speak specifically about safety, I don't think. But if you would just shoot me an email, Nan, like what are the specific questions? So you've got safety documents, we'd be happy to create those for you. And to Nan and anyone on the phone, if there are specific questions of like, what does this mean? How do we do this in a housing first way? Hotels, that's a great point. How do you deal with that? Please feel free to just go ahead and send me an email with those questions in it, and our team will pull together some either future trainings or documents. We can prioritize that in the next month or so that we can get that out before you have your contracts. Yeah, that'd be great. And then Kelly, I don't know if you know where it is on the DOH ESG page, but if you could find that link for the best practices spotlight and throw it into the chat, that would be very helpful. Okay, so we will get those documents together about safety and behavior in hotels. Any other questions, feel free to put them in the chat or send us an email. My contact information is at the end. I don't see any other CV2 questions, so we're going to jump over to ESG. So ESG 20, like I mentioned, we are going to primarily be amending ESG 19 grant agreements and extending the deadline and adding more money. Hopefully that will be an easier administrative process for everyone. There are a few waivers for flexibilities in regular ESG in response to COVID. The ones that are still in place, the primary one right now is that if someone is in an institution for 90 days or longer, they can still maintain their homeless status. Primarily, as you all know, if someone was in an institution for 90 days, they would lose their homeless status. HUD is granting some flexibility around that to allow folks to stay in those institutions and still maintain that status because they realize that that's a challenge during COVID. We are in the process of asking for an extended waiver to allow the fair market rent cap to be waived and allow us to use rent reasonableness instead. Have not heard back on that yet. We will let you all know as soon as we have that, but those are a couple of the flexibilities. The waiver process for the ESG funds has been also a little, there's been a lot of information coming out. They usually last for about 90 days. And then the waivers either expire or are extended or changed slightly. So if you are going through your processes and you have questions about what waivers are available, please let us know. Please feel free. I can't guarantee that we will always be able to answer your question, but we do have pretty regular contact with HUD TA, so we can get that answered for you if you do have those questions. Again, CAFE is going to be the HMIS comparable database. So we will need all of our DV providers. If you are using ESG funds to provide for DV folks, we'll need you all to transition into using CAFE for client management. You all should be using it right now to report to DVP as long as you are getting money from DVP. We know that not everyone is using it for client management. So if you're not and that concerns you in any way, again, please reach out to us. Like I said, we are working very closely with Chelsea and her team over at CDHS. And we have some capacity to help you all with that transition. Okay, Sage. So if you all received ESG between April 1st, 2019 to March 31st, 2020, you will have gotten a plethora of emails from us about Sage. This is a first-time requirement. They chose a very interesting year to transition this, but Sage now requires that subrecipients submit their CAPERS directly to HUD. Historically, you would submit your CAPER to us or to the COC if you were funded through the COC, and we would submit it as one document to HUD. But now we are required to send links directly to our subrecipients, and you all have to upload those CAPERS directly to Sage. We know this is a new process. For those of you who are working through this now, thank you. Friendly reminder to please get that submitted by the close of business today if you have not already done so. But it will be an ongoing requirement for regular ESG. Again, the HMIS leads will be pulling the CV reports and submitting that. So there's nothing that you all need to do for the CV funds. But for regular ESG, you will continue from ESG 18, which closed earlier this year, on, you will have to submit it directly to Sage. Part of the reason that we are requiring you all to submit your quarterly CAPRs to us is so that we can start looking at that data and make sure that when it comes to the annual reporting time, there are not going to be any errors or barriers that keep you from being able to submit it. So theoretically, once we get through the bumps of a transition, it will be a pretty straightforward process. But it's probably going to be bumpy for this round and probably the next round. So thank you all in advance for working with us. And again, as always, feel free to reach out if you have questions or concerns about that. You will see in the ESG 20 and CV grant agreements that we are requesting CAPRs be submitted to us as your quarterly report in an Excel format. We historically have not specified the format that CAPR needs to come to us in, and we are having it come in Excel so that our new and wonderful ESG team can actually dig into your data and see what errors that there might be, where we might have some data quality issues, and those sorts of things. Okay, ESG 20 will still require a 1-for-1 match. ESG CV does not require the 1-for-1 match. The ESG 20 will, unless your 2019 agreement did not include that 1-for-1 match, or you have had other agreements in place with your contract manager. If you aren't sure, as always, feel free to reach out. It will be in your contract budget what your match is. So please reach out before February 1st if you are feeling like you need a waiver on that match for any reason. We do have to have some sort of documentation of financial hardship as to why grantees aren't doing the 1-for-1 match. I think during a global pandemic, we can make that work. That's a pretty easy case to make, but that is still a requirement. It will still be in your grant agreement. And that is something that will still be part of the ESG 20 expectations. So we do have a couple of questions. So will the CAPR requirement to Sage be a one-time occurrence throughout the upcoming grant cycle? So the requirement to submit directly to Sage will just be the annual CAPR that's required at the end of the year. So you will see in your grant agreement, it requires like a closeout report, and that is when you will submit it to Sage. So it won't be throughout the grant cycle. It will be at the end as that final report, but it will be an ongoing requirement. So there will be one annual report required to Sage with every regular ESG agreement that you get. And then will DOH supply the Excel format? So Naomi, actually, you will just be able to pull that report directly from CAFE once we have built it out so that it can pull the CAPRs. And you can tell CAFE to pull it in an Excel format and it will pull it for you. You won't have to go in and manually input any data into Excel. It should just come straight out of CAFE or HMIS if you're not a DB provider, to other folks who aren't Naomi. Okay. That looks like all the questions and all the points. Okay, so next slide. All right. So now we're going to talk about grant administration basics regardless of your funding source. So whether you're getting ESG CV1, CV2, 19, 20, whatever, if you are getting ESG funds from the Division of Housing, these next few slides will apply to you. So we're going to talk a little bit about COVID best practices, duplication of benefits, pay request processes, and then data collection, and then again with that role of the fiscal agents. So just a note, please make sure to review the grant agreement. I know it's dense. I know it's a really long document. Everything that's in the main template is a requirement from the state office of the controller. That's not something that DOH can really change. Everything that's in your Exhibit B is going to include really important grant information and deadlines, how to submit your certificate of insurance, those sorts of things. So there are some new details for folks who have gotten ESG for quite a while that you are probably hearing from us now as we dig into these agreements. We will get into this a little bit later. Quite frankly, we are 99.9% sure that HUD is going to have some pretty arduous monitoring requirements after these ESG CV funds are out the door for a little while. And we, as a new ESG team, are trying to get our ducks in a row so that your ducks can be in a row, so that when we get monitored, and I'm saying if, not when, I'm saying it, when, not if, everything is good to go, and we can show HUD that we are being responsible stewards of these funds. So we know you've been getting a lot of emails from us. We know you've been asked for a lot of things. Thank you in advance, and just for the time that all that takes. That's probably not the last email that you will get from us in terms of asking for some of this documentation. So in light of all of that, your contract manager will be the primary point of contact throughout your grant cycle. I know you get a lot of emails from me, you get a lot of emails from Kristen Toombs or Allison George. If you have specific questions about reporting expectations, timelines, documentation, monitoring, any of that sort of stuff, Kelly, Chelsea, and Galen are going to be your primary point of contact. If you are not sure who the contract manager is, please feel free. You can either right now put your name and agency in the chat and we will answer those for you now, or you can shoot us an email afterwards and we will let you know. If you are new to ESG, it will be the person who sent you your, or even if you're not new to ESG, it will be the person who sent you your award letter. Those all should have gone out last week. That is going to be your contract manager. The deadline dates. Michelle, can you tell me which deadline dates specifically you are referring to? Each of the agreements will have different deadline dates, unfortunately, which I know is fun to manage. But yeah, if you can throw that into the chat, Michelle, I'd be happy to review that. Okay, I think that's everything on this page. Galen, would you go to the next slide, please? Okay, the CAPER report. Yes, so sorry. To answer Michelle's question about the CAPER report, if you got funds from April 1st, 2019 to March 31st, 2020, your CAPER report is actually due to SAGE by the close of business today if you are using HMIS. If you got funds during that time period and you are using and you are serving domestic violence folks, then you are not required to submit a CAPER until we roll out CAFE, which will happen later this year. If you are not someone who got money during those timeframes, you do not have to worry about that yet. But if you got funds, if you currently have ESG funds, so that would have been April 1st, 2020 through March 31st, 2021, May, June of next year is when you all will have to submit a CAPER. Again, if you have CV funds, the HMIS leads will pull that for you, so that is not a deadline that you would need to worry about. So Michelle, if that did not answer your question, please just let me know. Okay, touching on COVID again, and I'm actually going to pass this over to Kelly Forsauer, who's kind of been our internal emergency management winter shelter expert, to talk a little bit about COVID best practices with winter sheltering.
Awesome. Thanks, Cassie. So good morning, all. So I just want to review a little bit about, like Cassie was saying, the cold weather shelter planning and just some best practices for that with COVID. Some of you may have been on the cold weather shelter planning webinar that we hosted with some HUD TA folks. If you weren't able to make it, no problem. We did record that webinar and it is posted on the DOH ESG page. But some of the stuff that we definitely talked about that and just things that are important to keep in mind is definitely planning for the inevitability that, especially in a congregate shelter setting, you're probably going to have to make some adjustments from previous years of doing sheltering. So this includes putting in social distancing measures, also looking into some non-congregate options, especially if if your shelter has had a decrease by like 50%, what other non-congregate shelter options are out there to kind of make up that remaining 50%. So that can look like hotel motel vouchers and things like that that are provided through especially the CV funds. And then another big point that especially HUD TA pushed is that it's so important to have multiple plans for this season. Like Cassie was kind of talking about earlier, some communities may be in the preparing for or preventing COVID stage. Some communities might be in the responding to COVID surges in your communities, and some shelters might be responding to shelter outbreaks. And so having kind of levels of planning of what it looks like if you're just in the preventing stage, what it looks like if you're starting to see more cases in your community, and what it looks like if you're actually responding to an outbreak in your community. That's what like kind of having some of these like plans in place can really help with that. And then with that, we definitely still want shelters to be as low barrier as possible while understanding what the best practices are for providing shelter safely during COVID. And with this winter shelter webinar that we also hosted with HUD, we did get some resources from them as well. Some of the resources are posted on the HUD Exchange page, but also please feel free to reach out to your contract manager if you'd like some more of those documents, or if you'd like a copy of the PowerPoint from the presentation that we did that just has some additional information on, you know, how do you do that planning? What are good things to keep in mind? Things like that. Definitely encourage you to reach out because we want to provide as much support as we can. And then just kind of an overarching for all COVID best practices and response, especially with shelters, is please make sure that you're reaching out to your public health agency and make sure you know what your public health agency is doing in your community and vice versa, that they know what you're doing. It's definitely something we're having everyone on the same page and kind of understanding expectations for, you know, if there is an outbreak or how to do, like just how to respond to things that are happening, PPE needs and testing, all that kind of stuff. Just definitely encourage you to be reaching out to your public health agencies throughout the whole process of your planning and response efforts. And then Cassie, if you wanted to touch on the prevention part.
I do, definitely. I am also,
Perfect.
Kelly, if you wouldn't mind throwing that product that HUD created about the different plans for winter shelter, if you could find that, throw it into the chat. I was trying to find it while you were talking, but my internet's not as fast as you are, so I apologize.
Yeah, no worries, I got you.
Thank you. We know that prevention is kind of in a weird spot right now with the various moratoria that are in place. The state has an eviction moratoria. The CDC has an eviction moratoria. They're specifically around non-payment of rent. So you are still able to use other reasons for loss of housing with our ESG funds. If you are trying to help someone who is being evicted because of a non-payment of rent, unfortunately, ESG cannot be used for that. We do have other state resources as well, things like the EHAP program and the POP program that just received even more funding through the special session, which is very exciting. And we know that there is going to be a cliff, so to speak, when these eviction moratoria end at the end of this year. And so we just want to make a note that if you are planning to use homeless prevention funds through regular ESG, please be ready with the end. We've gotten a specific note from our HUD TA to just go ahead and start preparing for the end of that eviction moratoria. Right now, that's the end of this year. We don't know if that's going to change or what that looks like. If it does end, please make sure to have your files ready and be ready to go. We do know that there is that concern around the limit of being able to pay for 6 months worth of arrears. A lot of these moratoria have been piecemealed into place for more than 6 months. And so HUD is pulling together guidance on that. So if you're concerned about that, stay tuned. Hopefully we'll have more guidance there. But please just let us know what that looks like. Let us know how we can be helpful. We know the prevention piece specifically has been confusing. Again, we did just get a lot more money for EHAP and POP. EHAP, Emergency Housing Assistance Program, which is directly for households. POP is Property Owners Program, I think. We have a lot of acronyms at DOH, and that goes to landlords who are helping tenants who are unable to pay rent due to COVID. Please feel free to reach out and let us know about those if you have not heard of them yet. But yes, we just wanted to make a note that homelessness prevention is going to be tricky with ESG due to COVID. So, okay, next slide, Galen. Okay, just real quick, wanted to touch on duplication of benefits. There's a lot of money out there, a lot of co-occurring money, a lot of overlapping eligibility requirements, etc. So duplication of benefits occurs when clients receive more assistance than their need of a household. It also occurs when subrecipients charge multiple grants for the same costs. So we, as we are requiring subrecipients to have policies and procedures that help to make sure this does not incur. That looks like having budgeting documents when you're working directly with clients receiving rapid rehousing. That looks like having fiscal processes and procedures in place so that you as a grantee are tracking which funds from which grant go to which activity. It also includes internal financial controls that meet 2 CFR Part 200. If that's a really scary thing to you, if you've never heard of 2 CFR Part 200, please know that we are actively developing resources that will help us as well as our subrecipients meet these requirements. And that is something that we are going to be providing a lot of training on in the coming months. It is another really hairy federal regulation. We know that. And so we are trying to create those controls for our subrecipients if they do not have them already. I'm sure many of you do. But if you don't, please don't worry. We are working on that now. But duplication of benefits is something that we are sure that HUD will monitor for. And so we are going to monitor for that as well in the coming months and years. So I just wanted to clarify what duplication of benefits was, how it impacts you all as a provider as well as a subrecipient, and to give some next steps on that. Kelly, thank you for putting that winter sheltering document in the chat. If you all are doing winter sheltering, please make sure to look at that. It's very helpful. It is just another 5 or so pages for you all to read, but it's a great thought process of how to think through all these different plans and make sure that you have everything you need in place. Again, ESG funds can be used for those sorts of activities. And Kelly actually helped the HUD team develop this resource. And so if you have any questions about it, please feel free to reach out to us. We'd be happy to answer those. Okay, next slide. Yes, Elizabeth, we won't email it out to the participants because there's no way for us to track who is here on Zoom, or at least we haven't been able to figure it out. So if you all know how, let us know. But we will be posting the recording as well as the slides on our DOH ESG page, so you guys can access them at any point in time. Okay, just another note on duplication of benefits. We as the Division of Housing are not the only entity in Colorado who received a lot of money with ESG CV. So just wanted to throw up how we can have, how we are working with the other jurisdictions. So if you are an agency serving the city and county of Denver, the city of Aurora, or the city of Colorado Springs, those cities receive their own entitlement of ESG. We are working with those entitlement communities to collaborate on our funding. Just wanted to give an update though of how much additional money this is. So normally in a year we have about 3.2 million. Between CV1 and CV2, we have over 55 million. So it's a lot of money. We are working with entities to help track these funds, to help make sure that for agencies who are in these cities that it's as easy as possible. But we will let you all know what that looks like. Primarily, that's going to look like the naming convention in ESG, or I'm sorry, in HMIS. And it's going to look like our team doing some monitoring, which we will get to in a little bit. We could attach, yes, Elizabeth, we are using these slides through a shared Google Drive, a shared internal Google Drive. So Kelly, if you could work on maybe figuring out how to pull that off the Google Drive, if we could potentially link it in the chat or put it in a not shared Google Drive so that folks could access it. We have never done that, Elizabeth, so forgive us if we can't make it work, but we will try. Okay, next slide. Okay, actually, Kelly, if you want to dig into the pay request overview slides that are up now, I will actually work on trying to pull these slides in a linkable form. How about that?
Okay, that sounds great. Awesome. All right, so I'm just going to go, we just wanted to give a little bit of overview of the pay request process, especially for new grantees, and for existing grantees, there's going to be a little bit of a change with our new Neighborly system. So in general, ESG operates on a reimbursement system. The only exception to this is that with ESG CB1 and 2, you can do advanced payments if you can show like a financial need. So if that is something that comes up, just reach out to your contract manager so we can kind of walk you through the process for that. But in general, ESG is on a reimbursement. Pay requests must be submitted at least quarterly. And we know that for some, especially smaller agencies, pay requests submitting on a monthly basis is needed. So we can be flexible with that as well. Again, just make sure that you're communicating with your contract manager to make sure we kind of know what to expect with that. Pay requests also must include supportive documentation. So when you are submitting a request for reimbursement, these have to include documents that show a proof of service or when the cost was incurred, as well as a proof of payment. And we'll dive into that a little bit more in the next slide as well. And then ESG pay requests moving forward will be processed in our new grant management system called Neighborly. So for some ESG CB1 recipients, you may have already gotten into Neighborly and submitted some pay requests, or you may have at least kind of seen it so far. But we're still in the process of getting all of the ESG grants up and running in there. So you will see more information from us, and your contract managers will reach out with some more information on like how to log into Neighborly and navigating the system, things like that. And then pay requests should not include any client or personal identifiable information. So we just wanted to make sure that this is really clear that client, like especially full client names, date of birth, things like that should not be included in a pay request. If you have a form that you need to submit that for some reason has client information on it, that also shows a proof of payment or a proof of when the service and the cost was incurred, please make sure that you're redacting that information before you send it to us, just to make sure that all of client information is confidential and as secure as possible. And just got a note in the chat from Maureen. Will we be notified if our payment request does not have all the information you need? Yeah, so when we as a contract manager go through the pay request, whether it's in Neighborly or if you are an existing grantee and you've been emailing your pay request to us, if we need additional information from you, we will follow up to let you know exactly what it is that we're needing from the pay request, whether that's like if we need an additional receipt or if a particular item that you're requesting for reimbursement doesn't have proof of payment, we'll reach out and let you know that. So next, I just wanted to go over the payment request process. So this is how it will be moving forward, especially with the Neighborly system. But as a subrecipient, you're going to submit your pay request to your contract manager in Neighborly by completing a budget draw and uploading supportive documentation. When you go into the Neighborly system, there'll be a place where it's pretty easy to navigate to where you need to do that draw. You'll be able to see your budget as well, so it'll be very clearly laid out of how much money you have in each funding category, things like that. And then you'll be able to upload documentation to Neighborly. So for supportive documentation, things that we are looking for, if you're submitting for salary costs, we do need to see some kind of timesheet that indicates ESG time and a corresponding pay stub or payroll summary, or some type of documentation that shows how you all as the agency is calculating the time for people that you have, especially if they're not full ESG staff. Like if they may have half of their time goes to one grant, half their time goes to ESG. We as the contract managers just need to be able to review that to understand how you got that total. And then we're able to kind of, just verify it that way. Other supportive documentation and for like services or items purchased, things like that. We would need things like an invoice or a bill showing the dates, and then corresponding like a bank statement or a check that shows the purchase made. If it's like a receipt that has like that you've paid with like a debit or a credit card or something, as long as it shows that like you've paid with that form of payment and it has the dates and all the items listed on the receipt, that works as well. So then after that, after you've uploaded it, your contract manager will review it in Neighborly. And then like Maureen pointed out too, if we need any follow-up from you, we'll also reach out to see if we can get that additional documentation needed. And then we'll either approve or reject the amounts. Generally, if there's like an issue that we find that if there isn't like an item that you submitted for reimbursement, but you don't actually have like the proof of payment for it, that might be something that we'll adjust in the actual like drawdown. But we'll try to communicate with you as best we can for that as well. And then after we, as the contract manager, approves it, you should get a notification from Neighborly, and then it goes through into our accounting department. And then they will be the ones that actually release the payment to you through either electronic funds transfer or a mailed check, depending on what you're set up for. And if there's at any time you need to change any of that information, please also make sure to reach out to your contract managers. We can help facilitate any of that as well. And then one more thing I just wanted to note, especially for existing grantees. So you would be familiar with the pay request cover sheet that we had people submit for your pay request that just kind of broke down all the costs in one summary document. We won't actually have that pay request form anymore. If you want to still use it, or if you want to have another summary document, I know some grantees have kind of a breakdown of where they have all the expenses going to. It's not required, but it is very helpful for us on the review process so that we can kind of understand, okay, this receipt is going with this and under this category and things like that. So feel free to provide that if you'd like, but we won't be requiring that official pay request form anymore. And then Jacqueline, I did see your question too. If our ESG CV1 and CV2 funds are through a COC, will the payment request process be the same? So that's a great point. So however it's set up, and Cassie or Galen, feel free to chime in for this as well. But if it's through the COC will let you know how they will process the pay requests and stuff. But this is for primarily like if you have a grant directly with DOH, then this is how we're navigating and tracking the payment process.
Yep, that's perfect, Kelly. Just to reiterate, this is for the grants that are coming directly from the Division of Housing. Yep.
Awesome, thank you. And great question. So then the last thing I just wanted to review was our quarterly reports. So something that comes up a lot that we understand can be a little tricky is that quarterly reports are based on, the quarterly report schedule is based on a calendar year, not on the actual year that your grant is for. So for instance, quarter one is actually going to be January through March with a due date in April 20th. But for most, especially like, an ESG, the 20 renewal grants start in April. So your first quarterly report that will be due is actually for quarter two. But it's for like the first 3 months of your grant. So that can get a little bit kind of tricky just with the numbering. So we just wanted to make sure that we kind of like laid it out for you. And then all reporting questions will also now be in Neighborly. So for previously existing grantees, you used to have to submit a couple different forms to us that were like documents that we sent out at the beginning of your grant. You won't have to do that anymore. When you go into Neighborly for the reports, all the questions that were previously asked on those reporting documents will now be in Neighborly. The only thing that you will have to still upload for your reports is that CAPER report. So because that is something that's pulled from either HMIS or a comparable database, but you'll just be able to upload that in Neighborly like we touched on previously. And then for like the financial status report, some of those forms, those won't really be as applicable because the nice thing with Neighborly is now anytime you log in, you can automatically see what we have in terms of like how much money has been drawn down from each category and things like that. Especially for ESG, like regular ESG grants, we'll also have match tracked in there as well. So we won't really need that financial status report as much. Awesome. And then Galen, you can go to the next slide.
And this is Cassie, I did post the link for the slides today in the panel, or I'm sorry, in the chat. So feel free to take a look at that. If you have issues with it, please let me know. Our Google doesn't love to share links, unfortunately. That I did also want to note that Lindsay had asked if we had published something like a grant chart that shows the various deadlines across these 3 grants. That is in this slide deck, but if there is something more specific that would be helpful for you all, please feel free to let us know. We are happy to create that. The other thing I did want to reiterate about the match in Neighborly. So the way that we are going to be tracking the match is that it's going to look like a budget line item. And so when you put your request into Neighborly, you're going to request, let's just keep really easy numbers, $1,000 for emergency shelter, $100 for admin, and then you're going to throw in your match just to keep it even, let's say $1,100 for match. It's going to pull a final draw that's going to look like it's requesting $2,200. It's going to look like it's including that match as part of your draw request. That's probably going to cause a lot of confusion. Again, your contract managers are here to help you through that, but I did just want to throw that out there that we know that the system is doing that, and we have internal mechanisms in place to make sure that we're not actually reimbursing you for your match, but the system is not perfectly set up for ESG specifically, and that's the only way that we can actually pull our match. So we wanted to make sure that you all knew that we know. Probably going to be confusing. We do have a Neighborly training for subrecipients online as well at our DOH page. So we have already talked about data collection, so I'm going to be pretty quick on this slide. All recipients must be using HMIS or the comparable database, which is CAFE, for the entirety of the ESG grant agreement, which covers the time that it can be, that funds can be used to cover costs. So for ESG CV1, even though those agreements weren't executed until October? I don't even remember. Even though those agreements were not executed until months after March 27th, you do have to be using HMIS back through March 27th if that's when you are wanting to request the funds for. Same thing with CAFE. We realize that that is a tricky one because that's a newer expectation. So please let us know if that's going to be a challenge. And again, subrecipients will be reporting directly into SAGE for regular ESG and into Neighborly for the quarterly ESG for regular and CV1. So let's see that last minute. So again, I've mentioned this, but in Neighborly, we do specify that we would like CAPERS to be cumulative. So from the start date of the grant agreement to the date on which you are submitting the report. I don't think we have specified that timeline in the past, but we are going to be asking for cumulative CAPERS, again, so we can help you with that data quality issue. And then we are going to be asking for them in an Excel format, which you should be able to just pull directly from the system. Okay, I think we've talked about all of that, so I'm not going to stay on this too long. Next slide. All right, so we're just going to talk really quickly about fiscal agents. So a fiscal agent is an organization that is going to take DOH funds and pass them through to another agency. Oh, sorry, I did have one question about detail. So Megan, so for the cumulative report, so you have a quarterly report that's due in Neighborly, and it asks for a quarterly CAPER. We've never specified the time frame that we're really looking for in that quarterly CAPER. And so we will ask for the cumulative report from the start of the grant through the end of the quarter. So let's say the grant starts April 1st and you're submitting your report that's due January 20th, that will have covered April 1st through December 31st, right? Because you have 20 days after the end of the quarter to submit the report. So we would ask that you submit a Excel CAPER from April 1st through December 30th. So cumulative data from the first date of the grant up through the end of the quarter. If you have it, again, that's new. I don't think that we have specified timeframes for those reports. So if there are specific questions, then let us know. We just had a question, what are CAPERs? So that's a great question. CAPER is just the name of the annual report that HUD requires for ESG. I don't know off the hand what that stands for. I know it's an acronym for something, but let's see, this is from Response. So Response, if you all are in CAFE, we are going to be building out CAFE so that you can just click a button that says pull a CAPER. You'll know that the CAPER is your ESG report. It will pull the data from CAFE that is needed to satisfy that report. But again, when you meet with your contract manager, Thank you, Scott. Consolidated Annual Performance and Evaluation Report. When you meet with your contract manager, they will be able to talk you through that in more detail. Since you guys are new to ESG, that's going to be one of the many steep learning curves that we will help you work through. Okay, any other questions about data? Okay, I think we're good there. All right. So a fiscal agent is any agency who is going to pass through our funds to another agency to do ESG funded work. So if you are, we'll just use the COCs as an example because that's a pretty easy one. They get a grant from us as the Division of Housing for prevention and rapid rehousing. They pass that through to the actual organizations who are doing that work. They're not actually doing the work themselves. They are helping those grantees who are doing that work to manage the actual outcomes, requirements, etc. If you are a fiscal agent, you must have policies and procedures that align with all of the expectations outlined in 2 CFR Part 200. That includes things like procurement practices and policies and procedures and internal fiscal controls, etc. Again, we are developing tools for managing that expectation of 2 CFR Part 200. We will share those with everyone, regardless of whether or not you're a fiscal agent, but specifically our fiscal agent partners have to have pieces of that in place. I do want to make a distinction between like contracting out a service and being a fiscal agent. So if you are a shelter, for example, and you are contracting with a different agency to do HMIS data entry for your shelter, that does not count as a fiscal agent, right? They are doing your data entry for your ESG funded program. But if you are passing it through to a different agency, you're not doing the work yourself, but this other agency is, and you are managing them doing that work, then you are a fiscal agent. I know lots of our county partners would be considered fiscal agents, lots of our local government partners. I don't know of any small nonprofits that are fiscal agents, but if I am explaining this and this sounds like exactly what you all do with these funds, please know that you would then be considered a fiscal agent, and there are additional requirements per the ESG regs that we want to make sure folks are familiar with. Again, we're developing tools for that. But if you are planning to do this, or if you are already doing this, please make sure your contract manager knows it. One of the additional things that we will have in Neighborly is actually the ability for our fiscal agents to report on who they are funding and for what and how much and for what deadlines and all of those sorts of things. We will also have the ability in Neighborly for you all to upload your sub-agreements with those agencies into Neighborly, and that will be part of your reporting requirements. Again, just trying to get our ducks in a row for when HUD inevitably audits these funds. So if you are planning to do anything like fiscal agent oversight or pass through, please know that there will be additional expectations of you in terms of how you are reporting that back to us so that we can report it back to HUD. We get very layered and bureaucratic in these federal funding opportunities. So if this is new to you, please reach out to us, let us know. If you have specific questions, please let us know. When will we have access to Neighborly? Julie, it depends on what fund you have. If you have ESG CV1, you should already have access to Neighborly. If you don't, let us know. ESG CV2, you will have access as soon as those grants are executed. And for our regular ESG grantees, we will be requiring Neighborly entry with this next upcoming quarterly report. So the quarter ends December 31st. You all are required to submit quarterly reports within 20 calendar days after the end of the quarter. So I don't remember off the top of my head if we've already added you all to Neighborly, but if we have not yet, we will be doing so either later in December or early January. You will have 15 days before the grant is, the report is due that you can actually get into the system. And I believe 15 days on the back end as well that you can get in. So you'll have a full 30-day period where you can actually go in and submit your report. So Julie, if you have CV1 and no one in your team has gotten access to Neighborly, please let us know. Okay, next slide. Just have ESG. Okay, Julie, we will be reaching out, like I said, later this year, hopefully, if not by January 5th at the absolute latest. Okay, so I've kind of been hinting at this throughout the whole presentation. The DOH team will be conducting monitoring across our grantees in the first quarter, likely flowing over into the second quarter as well, because we have a lot of grantees of 2021. This is for ESG and ESG CV. We will be reaching out at least one calendar month in advance to schedule these monitorings. We'll be including an explanation of what is to be expected. Obviously, this is going to have to be virtual monitoring that will look very different than how we've done on-site monitoring. And please know that this is just because we know we are going to get monitored due to the increased funding of CV funds. So we just wanted to give you all a heads up. I don't have much more detail than that at this point because we're still trying to get the CV2 contracts out the door. But that's our next task, so to speak, as a team, is that we will be doing monitoring early part of next year, just trying to make sure that this is that everybody's ducks are in a row and we have everything that we need to show HUD that we, as the state of Colorado, are responsible stewards of their funds. This is not, you know, in your contracts in the monitoring section, you'll see that the language is around risk-based monitoring. We aren't doing this because we think there's a risk of inappropriate use of funding or anything like that. We just want to make sure that everyone has the tools they need, the questions that are answered, the processes in place to be doing the ESG and ESG CV funding. We will likely prioritize the folks who have ESG CV, and then also looking at folks who have ESG as we have time after we do the ESG CV folks. But most of our grantees have both sources of funding, another reason why we are going to be doing this. So just want to give you all a heads up. Like I said, we'll be reaching out at least a calendar month in advance to schedule meetings, give you a very clear expectation of what we will be looking for, and then hopefully moving forward with a pretty smooth monitoring process. Okay, no questions. Next slide. Okay, so we got through it all in an hour and a half. Thank you guys for sticking with us. We are here to answer any questions you might have. Galen, if you would actually go ahead and go on to the final slide. This has my contact information. Please, please, please feel free to reach out, ask us questions. That is my cell number. Give me a call. Let us know what additional questions or concerns you all might have. If you do have any questions, you can put them into the chat now. We can try and unmute if you would like to come on and ask a question. Our team will stay on for a few more minutes. We do have another 15 minutes of the scheduled meeting, but if you guys don't have any questions or concerns, look for this recording on the DOH webpage in the next week or so. And as always, thank you for what you are doing. Thank you for staying on the front lines, doing this work, helping the folks in Colorado experiencing homelessness. We are here to support you and just want to make sure that you all know how much we appreciate the work that you are doing every day. I do have one question. Can we use hazard pay with regular ESG funds? Nancy, that's a great question. We haven't gotten a straightforward answer from HUD on this yet. The way that we are interpreting it is that ESG is used for shelter operations and essential services. And if your staff, if you need to pay essential services, or if you need to pay hazard pay through those line items that you already have as part of operating your shelter, you should be okay. Excuse me. We haven't gotten that in writing from HUD. But as long as it's part of your staff salary, as long as you have policies and procedures in place that show why you are using ESG with hazard pay, you should be okay. But take that with a grain of salt. To be safe, I think using ESG CV funds is probably the safer option. But if you don't have an ESG CV agreement and you do need to do hazard pay, I think it's okay. We got another question. If we haven't gotten neighborly details yet, when should we expect to receive it? So Jennifer, it depends on what funding you have from us. If you have ESG CV1, you should already have it. So please reach out and let us know if you don't have it yet. If you have regular ESG, you should be seeing it in the end of December. And if you have ESG CD2, you will see it as soon as those grants are executed. In regards to households with leases, fitting ESG occupancy criteria for homeless prevention funds, does DOLA have any guidance around standardized documentation for property managers to complete to help households fit ESG criteria during the ongoing eviction moratorium? Evan, we actually passed that question along to our HUD TA, and we should be getting some standardized templates from them in the next week or so. So keep an eye out for that. I don't think we have anything off the top, just because the COCs have such different nuances that usually those templates come from the COC, but we did pass that on to them, and we are seeing if HUD has any. So we will send those out as soon as we have updates there. Okay, I have a question about CAFE. If we are using a database other than CAFE, can we pull the CAPER report numbers and enter them into the system? All report numbers are trackable back to the individual records and thus justifiable. Yes, alternatives to violence. Yes, we are, honestly, it depends on how our Office of Information and Technology builds out the CAFE system. We think that that's possible. We are not sure. That being said, we are actually in the process of getting some additional guidance from HUD as to if that is allowable within their definition of a comparable database. So stay tuned for that. If you wouldn't mind actually sending that question to me and your contract manager in an email. Let's see, you are in Loveland, so your contract manager is Kelly. If you would send Kelly and myself an email with that question specifically, just so that I can make sure to give you the answer when we have them, I will clarify that. I do think we can upload information into CAFE and get the CAPER as a stopgap measure, but I do not know if that is actually eligible per HUD's guidelines of what a comparable database is and the data process that things have to go through. I know that folks are doing it for HMIS too, so that's part of what's making me think it might be possible, but yes. Megan, can I get the information for our HMIS leads? Yes, I will send you an email and CC them, so I will draft that right now. And then let's see, what other questions do we have? Oh, never mind. Kelly already got it. Perfect. Thank you, Kelly.
Yeah, thanks, Kathy.
Yeah, of course. For hazard pay documentation, do we need to submit timesheets and pay slips for every staff person, or can we submit a report for all hazard pay paid out? Since we are paying a lot of staff members, it would be a huge. Okay. So for the hazard pay piece, whatever we need to see connection to the ESG funded operations. So Keely, it really depends on how you all are using ESG. We have to have documentation that makes sure that all hazard pay goes to folks who are doing ESG eligible activities. So if you have folks on your staff who are doing things that are not ESG eligible, I'm thinking like admin or funding. If you guys have rapid rehousing and you're giving services for folks who are not in the ESG funded rapid rehousing, those sorts of things, we'll have to figure out a way where you guys can submit the documentation that shows the hazard pay for the folks who are just doing the ESG eligible stuff. So yeah, feel free to reach out to Chelsea, who I believe is your contract manager on that. Evan, oh, perfect. Just resubmitting that question. And then Keely, just frontline staff at our shelter drop-in. Yeah, if that's funded by ESG, then you should be good to go. But again, we will have to see somehow that all of those staff folks are doing ESG eligible activities. And so that really just comes into additional documentation. So yeah, definitely talk with Chelsea. She's not on this call today, but I will make sure to pass that on to her and we can go from there. Okay, I don't see any other questions in the chat right now, so we will stay on just for a few more minutes, but if you guys do have other questions and concerns, again, please feel free to reach out, And thank you all for the work that you are doing. And thank you for staying with us for an hour and 40 minutes on Monday morning. We appreciate it. Galen, I think you can go ahead and stop the recording. Thank you for doing that.